Chronic abdominal pain have four most common causes. First is GERD or gastroesophageal reflux disease. Second is irritable bowel syndrome. Third is gallstones. And fourth is peptic ulcer disease. We will discuss symptoms, differences, and treatment of each disease. Gastroesophageal reflux disease, also known as acid reflux, it is called GERD, and it occurs 10 to 20% of abdominal cases. Most important symptoms are heartburn, regurgitation, chest pain, and difficulty swallowing. Heartburn usually occurs around chest, and regurgitation is when stomach acid or food backs to the throat and patient feels it. Symptoms usually worsen after eating or when person laying down. Diagnosis is made by endoscopy and pH monitoring. Treatment includes lifestyle modification such as weight loss, avoiding trigger foods, elevating the head of the bed, antacids, H2 blockers, proton pump inhibitors, and in severe cases, surgery may be needed. The most common cause of abdominal pain is irritable bowel syndrome, also known as IBS. IBS accounts 10 to 15% of abdominal pain. Hallmark of the disease is abdominal pain, bloating, gas, diarrhea, and constipation. Sometimes diarrhea and constipation alternate, and most important thing is that this recurrent pain related to defecation. So sometimes defecation aggravates symptoms, sometimes defecation relieves symptoms, and patients often describe irritable bowel syndrome as crampy, sharp, or stabbing pain, which comes and go, and intensity can vary. Patient also reports bloating, gas, and sometimes sensation of incomplete evacuation after bowel movements. IBS is recurrent abdominal pain with altered bowel habits and no structural abnormalities. So here most important part is that no structural abnormalities, so we should exclude other diseases, and after exclusion of other causes we can make diagnosis of irritable bowel syndrome based on symptoms. Treatment of irritable bowel syndrome include dietary modification such as low FODMAP diet. Low FODMAP diet means food which is low in such carbohydrates which fermented and which can cause gas production and which can cause hypersensitivity or inflammation into intestines. Also person should increase fiber intake. Stress management and relaxation techniques is important because irritable bowel syndrome is strongly related to stress. Sometimes patients intake over-the-counter medications such as antispasmodics, laxatives, or antidiarrheals, and sometimes antidepressants are also needed. Patients with IBS should avoid coffee, alcohol, high-fat food, fructose, spicy food. Exact cause of IBS is not known, but it's thought to involve a combination of factors including abnormal gut motility, visceral hypersensitivity, and altered gut-brain communication. Stress, diet, and genetics may also play a role. Third important disease which causes abdominal pain is gallstones. Gallstones occur also 10 to 15% of cases. Common characteristic of gallstones are biliary colic, typically triggered by fatty meals, and it has specific type of pain which we will describe, and usually it located in the upper abdominal part and may radiate to right shoulder or back. Here is pain location, upper right abdominal part, which can radiate to back and right shoulder. This pain is intensive and usually aggravated by intaking fatty foods. Gallstones itself are solid deposit that forms in the gallbladder, usually due to imbalance of bile components. Risk factors include obesity, rapid weight loss, high-fat diet, and genetics. Treatment include watchful waiting. In most cases, person can have gallstones and no symptoms or very mild symptoms. If symptoms are intense, surgery is recommended, and in some cases there are some medications like ursodeoxycholic acid, UDCA, which can be used for prevention, for example during diet or if surgery is not possible. Another cause of abdominal pain, an important cause, is peptic ulcer disease. Peptic ulcer disease is caused by bacteria Helicobacter pylori, and it causes burning and gnawing abdominal pain, sometimes nausea and vomiting. Now let's see pain location. Pain location usually is upper middle part of stomach, just below rib cage. It can be slightly left or slightly right. And peptic ulcer disease can be caused by gastric ulcer and duodenal ulcer. If it's caused by gastric ulcer, it's slightly pain, slightly left. If duodenal ulcer, pain slightly right. In case of gastric ulcer, pain aggravated by eating. In case of duodenal ulcer, pain decreases by eating, and in case of duodenal ulcer, pain occurs during fasting periods on empty stomach. In case of gastric ulcer, eating aggravates condition and pain. So, in case of gastric ulcer, person can weight loss, and in case of duodenal ulcer, person can weight gain because eating relieves pain in this case. That's why person can weight gain in this case. Now treatment. Treatment is classical treatment, which means 3-component antibiotics, amoxicillin, clarithromycin, and metronidazole, prescribed for 7 to 14 days. Proton pump inhibitors, also very common, such as omeprazole, pantoprazole, and lansoprazole. H2 blockers also important role, such as ranitidine and famotidine. That's peptic ulcer disease. Now let's summarize. Abdominal pain is caused by 4 most important diseases. First is GERD or gastroesophageal reflux disease. Second is irritable bowel syndrome. Third, gallstones and peptic ulcers. Gastroesophageal reflux disease is heartburn. If pain is burning nature and if it occurs on chest region, it's with high probability gastroesophageal reflux disease. If pain occurs lower part of the body, lower part of the abdomen, and patients cannot specify where this pain is exactly, but it is below lower part of the abdomen and usually middle. It's IBS or irritable bowel syndrome. If pain is sharp and stabbing and occurs on the right region of the upper abdominal space, and if it radiates to right shoulder and back, it is gallstones. If pain strongly related to eating, if it's aggravated eating, or if it's relieved by eating, is peptic ulcer disease, and it can be gastric ulcer or duodenal ulcer. Gastric ulcer aggravated by eating, duodenal ulcer is relieved by eating. That's all for today. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.